Hi, my name is Becca Glowinski. I'm a third-year MD PhD student at The Ohio State University College of Medicine. I'm here tonight with Dr. Anita Samani and Dr. Claire Wolf to discuss being a woman in medicine. I will be wearing a mask tonight because I work in a COVID lab, so please bear with me. Thank you both for being here.
Thank you.
When you two first realized that you wanted to be doctors, was there anyone in particular that either encouraged or discouraged you from this path?
I'm older. I'll go first.
Okay.
Because when I went to medical school at The Ohio State University College of Medicine, there were 8 women in the class.
Of how many?
8 out
Eight
of
out of-
144.
Oh, wow.
Wow.
And when I was growing up, I was the first person to go to college. But my parents always said, do whatever you want to do. And I wanted to be a doctor from the age of at least 10. There used to be a show on early television, one of those little screens in the Dumont television box with Richard Boone playing Dr. Conrad Steiner. It was called Medic. It was you can still get it on YouTube. And I watched that show every week and said, I want to be a doctor. I never wanted to be a nurse, wanted to be a doctor. And the only people who ever discouraged me was my aunt, who said, how can you be a doctor if you want to ever get married and have children? You have to be a teacher or something like that. And I said, I want to be a doctor. Want to be a doctor. So I was very single-minded. And maybe because of that, and I go to a lot of women's things and have for years, and I hear all of these horror stories still of discrimination against women. And I always say, I must have been so obtuse that if somebody discriminated against me, it went right over my head, because whatever I want, I just did it. I said, this is what I'm going to do. I'm going to do this. And so I did.
Dr. Samani?
How about you?
So ironically, I didn't realize you started in 64. I started med school in 84, which is 20 years later.
Oh, geez.
And 25% of our med school class was women. I don't remember the exact numbers. I never remember those kinds of details. I tend to do big picture stuff, but yeah, 25%, so 1 out of 4 women. I'm with Claire in the sense that I know there was discrimination, but I kind of was like, whatever, I'm here, I'm going to become a doctor, so I'm not going to pay attention to this. When I went through med school, so you asked who inspired me. My dad is a doctor, so I'm like, my daughter is a 3rd-generation physician. And as an Indian male, he was very adamant that his daughters get the same education that his son did, which is unusual. I mean, usually in India, it was like, oh, you're going to have an arranged marriage and we don't need to put money into educating you. But he really strongly was of the opinion that we needed to be educated equally to what my brother was. And the irony of all that is my sister and I are doctors and my brother's an engineer. So, from a young age, I think my mom was the one who was like, you should be a doctor. And I kind of rebelled and said, no, I'm going to be a teacher. And, by the time I hit high school, I went back, and it was funny looking at my high school yearbooks and stuff. I was the person most likely to go to medical school, to become a doctor, And then I really, really, really thought about surgery. Like, I was like, oh, I'm going to become a plastic surgeon, and I think it's going to be really great. And as I did surgery, you get a lot of, and now I think, oh yeah, people would describe that as being sexist or being misogynistic. But at the time I was like, well, I think I can give as good as I can get. So I tended to be right there, like, what can I do, And I was probably a little more assertive. And the residents were, really, really helpful. I mean, and I have to say there were a lot of male residents that gave me a hard time, but there were a lot of male residents that were like, here, let me show you how to do that. Let me help you with your suturing. Let me, teach you about this. So I loved surgery, but I just couldn't. At the time, Dave and I were commuting back and forth. He was here in Columbus working. I was in Toledo going to med school, and I just couldn't fathom doing a 6-year residency. And then at the end of my 3rd year, I sent out for applications for internal medicine, OBGYN, and general surgery. I hadn't done OB yet. And I didn't know, like, maybe I'll like it, maybe I won't, but I'm going to send for all the applications. If I had to do it over again, I would definitely try to learn from other people more than like saying, I can do this, I know how to do this.
You two both raised families while you were also working as a physician. Can you tell me about any of the challenges or rewards of being a working medical mom?
Yeah, the rewarding thing is that they're not in the penitentiary when they grew up. That is the rewarding thing. But both of my children were difficult, and I don't think it was due to my parenting. I hope not. But you know, they've turned out to be wonderful men. I think it's rewarding, but I think it is a definite challenge to combine a full-time career. And when I was in practice, there were so few women. I never thought to ask for part-time. I never thought to ask for time off. I was back at work after each delivery, probably within 3 weeks, never asked for more time. I had 2 miscarriages. I just went back to work the next day. Just never thought to ask. And I don't know if that thinking is still pervasive among the current generation. I think it is not. I think they feel comfortable enough that I'm the only one having the babies.
But the male residents are getting time off.
They are.
So
They are.
I think that it's become much more equitable in that way.
Yeah, and we're talking like 50 years ago. I
So-
mean, you know, it's like,
When I was pregnant, and 1989 I was pregnant, my son was born in February of 90, there was no maternity leave policy. And they're like, what are we going to do with you?
exactly.
And I ended up having preterm labor. And so then they had that added complication of now, what do we do? So it was kind of like winging it. I mean, I took CREOGS, which is our in-service exam that you take during residency, and you take it every year. I'm on magnesium sulfate to stop preterm labor. And I'm in labor and delivery, and they turn off the mag for a couple hours. My nurse proctors me so I can take CREOGS.
God.
I'm like, and like you, I didn't even think like, is this normal? Like, should I be questioning this? I'm just like, in my head, I was like, if I don't do well, at least I have room for improvement. And, you know, that's where we're going to go with this. And I was doing like sort of chart reviews and stuff because, you know, I was off and they were like, well, you know, we don't want you to have to make up time. You've already made up your call. So, I mean, and in today's world, can you imagine like anybody going, oh, guess what? You're going to be taking your in-service exams with your nurse proctoring you while you're on labor and delivery. So you asked about, you know, the balance, the medical, you know, balance of being a medical mom. Honestly, I don't think it's limited to medicine. I think that anytime you're a professional woman, you face the same things, you know, whether you're a lawyer, whether you're, you know, a CEO, whatever.
Teacher, even a teacher.
Even a teacher. I
They
mean,
have to do that.
you're always juggling. You're always figuring out what is going to work to have, you know, kids that don't end up in jail or kids that like are successful. So, yeah.
And the reason is because it seems to be women's assumed responsibilities, that it is their job to do this. Whether you are a doctor or a lawyer or a teacher or a secretary, it seems to be the woman who worries about getting the kids to practices, getting them to the doctor, being there when they're sick. Even if you have the most supportive spouse in the world, women seem to feel guilty if they lay off those responsibilities. And I don't know if that is intrinsic or if it is societal.
I think some of
Or-
it's societal.
It may be.
Because, I mean, there were so many times. I mean, you guys met Dave. Our kids when they were little didn't really look like him. They had dark hair. Kyle had darker skin than Kara. And people would consistently go, "Oh, are you babysitting?" And he's like, "No, these are my kids." Like when men do things or take care of their kids, it's, "Are you babysitting?" When women are with their kids, it's the assumed, "Oh, you're with your kids."
Oh,
So, and he would, oh my God, it would just drive him crazy because he's like, "Why do people think I'm babysitting?"
Do you have any advice for women who are currently going into medicine or who are practicing physicians who run into these instances and have to deal with them as well?
I'll tell you some of the best advice I ever had was my first year of college at Ohio State. I was from New York. I came to college here, so I was away from home, and I started quite, I always wanted to be a physician, and still had people say, "Really? You're a woman, blah, 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 blah." And I was so stressed out. I went to the Student Health Center, and I saw a psychologist there, a man. And he gave me the Minnesota Multiphasic Personality Inventory Test, which at that time was a test for men and a test for women. And he gave me the MMPI for women, and I matched, physician was my lowest choice.
Really? Wow.
And I said, "Really? I really thought I wanted to be a physician." He said, "Claire, just for the heck of it, take the MMPI for men." And I matched number 1
For physician.
for physician. And we talked about it, this guy, and I said to him that, why am I feeling so stressed? I feel like if I go to medical school, I think I want to someday get married, I want to have kids, and maybe I'm taking the place of some man who would work maybe a lot harder or a lot more than I would. And he said, and maybe you'd be taking the place of a man who was the world's worst doctor.
See, you had some really good male role models.
I really did.
You really
this
did.
guy those words have never left me.
Yeah.
He said, you should do it and never look back. And I never did.
You're both part of the new CMA Women in Medicine work group. Can you tell me a little bit about that and why you wanted to join?
It's a chair right there, so she can talk. I was sucked in.
And somehow it fell into my lap. So I obviously was a past president, just like Claire, of this Columbus Medical Association. I think that with how medicine has evolved, there is so much more of these silos that we've created. People who are hospitalists are only at the hospital. People who are in private practice tend to just be office-based. So for me, having this group within the CMA was an opportunity to bring people that have different needs, have different working environments to kind of get to know each other. I mean, because so often, I think when you're in family practice or you're in internal medicine, you are referring people into the hospital, but do you know the people that then are taking care of your patients? So it gives them another way to connect. And I think, the problems haven't changed. I mean, Claire and I are talking about the same problems and we're 20 years apart. So when I look at, now my daughter I've been in practice 28 years and dealing with the same issues. So I think that having a multi-generational, having women that are of different eras really can help and can create that sense of community that maybe we don't have now within a hospital setting, or even within, less people are joining organized medicine. So that also creates that separation of people who want to maybe be part of the bigger picture, and then those who look at medicine as a job and sort of shift work.
I think the thing that medicine has lost with the new siloage, if I may, or silage, I guess is the word, is the community of physicians, male or female. It used to be that doctors made rounds on their own patients in the hospital and took care of their patients in the hospital. So in the morning, you would go to the hospital, even I, who didn't have inpatients, you'd go to the doctor's lounge, and there would be 30 people in the doctor's lounge having coffee or a donut or something like that, and chit-chatting with each other and talking about problems and issues, etc., and having that community profession feel. We belong to the group, we belong to the hospital, we belong, to this community. And what's happened is, and this is irrespective of male, female, is we've totally lost that. Nobody has lunch together. Nobody has the morning breakfasts together. You have hospitalists who have absolutely no relation to the patient. You have the physician whose patient it is, who doesn't take care of that person when they, in my opinion, most critically need the person who knows them the best. And I don't know that we'll ever get that back. And one would hope that organized medicine would provide a forum for that feeling of community, of being a physician, being part of this profession. It isn't a job, it's a calling, it's a profession. And I think the people who do best in it view it as a calling and a profession. And those people who've done the leadership program, those people who are very active in CMA or OSMA, I think have that feeling still of community, of participation, of doing something for the patients, the population, for their profession. But it is very difficult to get people back into that mode when they've grown up without it in residency and in medical school even. So I think the Women in Medicine grouping is an attempt to bring back a pride in I'm a woman, I'm a professional, I'm a physician. So, I'm hopeful that the group will provide that platform for women, in our case, to have pride in being a woman, pride in being a physician, pride in being a spouse and a mom, and if they need the support of the group to juggle all of those things, to have people to help them. So,
And I agree. Resilience, a sense of pride helps you limit the amount of burnout you feel.
Well, on that note, thank you both for joining me tonight.
well, thanks, Becca. As you could tell, you didn't need much prompting from the two of us to keep running away.
You did my job for me.
I mean,
we'll just keep talking.
we're used to talking. It's not a problem.